Good evening, good morning. Welcome to this international webinar for HPV Awareness Campaign, supported by IPVS and hosted by the MENA Coalition for HPV Elimination. I must ask if I'm audible. Right, okay, thank you. So today's topic is something which is really close to all our hearts, and for us as clinicians and researchers who have ever seen one single woman suffering from cervical cancer or another HPV cancer, we all know that for men and women, the misery is just beyond the scale. The agenda today is that I have a very esteemed panel of a couple of ladies who are literally the stalwarts in this area, and I would ask Dr. Margaret Stanley to go ahead and introduce herself, and then Miss Anita Wiseman. Professor Margaret Stanley, can we have the pleasure, please?
Thank you very much. I'm Margaret Stanley, and I'm the former president of IPVS and now a member of the Awareness Campaign Committee. I've worked on HPV since the early 80s when Harold Zurhausen first isolated HPV 16. And I've been heavily involved in the development of vaccines and in advocacy for vaccination. And so I've advised WHO, the UK, JCVI, and other bodies, the European Centres for Disease Control, on HPV vaccine programs, which I support wholeheartedly. And it's a huge pleasure for me to be on this webinar today, particularly with our partner, MENA. And MENA have done, in my view, a fantastic job in their region in involving people and getting them to contribute. So thank you, MENA, and I'm delighted to be here today.
Thank you. Anita, do you want to please go ahead?
Yeah, well, I don't have quite the amazing credentials that Margaret has just trotted out, so I'm honoured to share a platform with you, Margaret. But I'm the campaign manager and partnerships lead for the IPVS's awareness campaign for HPV. I've been here since before the first HPV Awareness Day, making the plans for that, and have worked closely with Margaret and Joel and the rest of the campaign committee to bring this campaign into being and to really drive the audiences that we've been able to drive for that. And it's been an absolute pleasure to see that grow and to see it develop and to see new partners coming on board, including the MENA coalition. So delighted to be here today.
Wonderful. Thank you so much for joining us. And I am an OBGYN. I am based in Pakistan, but I have been trained all the way through in the UK. I'm a fellow of the Royal College, and I'm also serving as a sexual reproductive health champion of the Royal College. These days, I have worked extensively for establishing cervical cancer screening program and introducing vaccination in Pakistan, and serve with WHO as the advisor for the global guideline groups as well as the EMR strategy group. So it's my pleasure to just really get the ball rolling here. I'm going to say a few words about MENA and East Mediterranean Region Coalition for HPV Elimination. And that will be followed by Professor Margaret Stanley and then Miss Anita Wiseman. And we'll come back to Pakistan then, and then we'll have a question-answer session and a discussion about the next HPV Awareness Day in March. So can we go to the next slide, please? Okay, so this area, as already has been highlighted by Margaret and Anita, we are the Middle Eastern North African coalition here. And this is an organization which has been working for over 5 years now with the tagline of helping to eliminate HPV-related cancers, and particularly cervical cancer in context of women's health when we talk about it. There's a great deal of diversity in the memberships. We have gynecologists, we have epidemiologists, we have public health specialists, CSOs, NGOs, and researchers. And the vision really is to see that this area gets rid of the HPV-related cancers. And as OBGYNs, I think Dr. Margaret Stanley would agree with me that we strongly believe that cervical cancer should be the first cancer that can be eliminated. Since we know what causes it, we have the vaccination, we have the screening tests, and if we pick up it in an early enough stage, it can be completely cured. Next slide, please. So this is just a picture of the host, East Mediterranean NCD Alliance. The countries included in this alliance, there are 22 countries, some Arab, some African, and then 3 Asian countries. And essentially, they share a lot of common themes in sense of the socio-cultural context, the women empowerment, status of women in the society, and that gives cervical cancer a very specific gender lens. And when we talk about this disease, it becomes evident that we are talking about a disease with significant inequity in care and resource allocation. Next slide, please. So WHO in EMRO has specifically produced this regional cervical cancer elimination strategy. And this has been a beacon of hope for all of us. And even in Pakistan, we are now just beginning to conduct a situation analysis for prevention and screening of both breast and cervical cancers. And this is just a snapshot of the data and the resources which are available at the MENA HPV Elimination and EMR website. You can look at the strategies. There are fact sheets about HPV and cervical cancer. And we are in the process of moving to a situation where we can actually translate them into the further regional languages. So with this introduction, we are very pleased to have you all on board, and I will pass the dice on to Professor Margaret Stanley, who will continue from here on. It's over to you, Margaret. Thank you,
Noreen. IPVS is an international society for individuals, professionals who work on HPV right across the spectrum, from people in laboratories doing sophisticated electron microscopy through to public health and clinical specialists working in the clinics and dictating policy. Because of this spectrum, we can call upon leading experts in the field at any time. Now, our major advocacy effort is in the Awareness Day and the Awareness Campaign. And there are 4 objectives. When we started back again around about 2018, we looked at did people know what HPV was? And the answer was, my goodness, they didn't. Go into society after society, high income, low income, and about 1% of individuals would know what this virus was. So our first objective was to raise awareness of what this virus was, that it exists, and particularly understanding how it was transmitted. And this stimulated a terrific conversation, because the transmission is a sexually transmitted transmission most, but not all the time. And this is a very difficult communication issue to handle. So one of our objectives is to get the conversation about this appropriate wherever we speak. So we're stimulating conversation to reduce stigma. And this is really for the first and the fourth and critical objective is to inspire people to take action to prevent cancer. We've got a vaccine that prevents infection with the major cancer-causing viruses. We have screening, which is very sophisticated in some countries and one has to say vestigial in others, for cervical cancer. And for those cancers which are not amenable to screening, then we have to raise awareness so that people detect it early. Because early detection, of course, is crucial in the ability to take curative action. So that's what our campaign is all about. Those are the objectives. And who are our targets? Next slide, please. So the people we're trying to target for cervical cancer in particular are divided, I guess, into two groups. They're the dreamers, that's the teens, the young people, frankly, who are not interested in preventive medicine because they're never going to get sick and they're never going to die. So our job is to make them aware of the virus and to make them say, I want this vaccine because it's going to take a big concern out of my life. And then as far as cervical cancer screening is concerned, we are targeting the women who've not been vaccinated or who may have been vaccinated, but nonetheless are still at risk. And screening takes that risk away, providing it is linked, of course, to treatment. And that is the final pillar in the various activities treatment. Now, there are three groups heavily involved in delivering these messages. There are what we call the gatekeepers, the parents, the educators, the spouses, the family. They've got to be convinced that this is a vaccine you need, this is a vaccine that works, and this is a vaccine that will do its job. So that's our crucial job there. And that is also to tell the people who are going to put the money into it and to implement the policies, the facilitators, the policy makers, the medical professionals, the health agencies. I have to say that the medical professionals are absolutely fundamental. Who do you trust when you want information about your health? Your medical professional, your doctor, your nurse. So they have to be sure that all these interventions we have are worth it and that they will work and that their patients will benefit from them. And to do this, of course, we've got to make sure all these interventions are accessible and available, and also that there are the cultural barriers which may exist and exist across global societies have to be recognized, be honest about, and to tackle. And that, of course, is the job of all of us, the advocates, the organizations like IPVS, the survivors, the people who've been through this dreadful process, and those who are prominent in society and want to do something about it. That's to use their reach to create awareness and pull. Next one, please. So this is our motif. This is our tagline for our campaign. One less worry. Why did we choose this? Well, it's because what we do with HPV intervention does take a massive worry out of your life. Because with 24-hour news, with constant internet, social media, the world is a very confusing and often frightening place. Suddenly you hear about a disaster 5 seconds after it's happened. And that makes you worry, makes you stress. Now we can take out one worry, and that's the worry of developing a ghastly cancer by getting to preventing infection with the virus, treating the lesions that have happened, detecting the serious ones early. And that's why one less worry is our concept, because we're in control. By doing these things, we take control of our own health. Critical. Next one, please. And we culminate in our campaign in International HPV Day, which is March the 4th, 2024 this year. And each year that we've had this International Day, we've concentrated on one aspect of prevention. First of all, it was vaccination. These are the pillars of the WHO, trying to get 90% of girls and frankly boys, because this is an equal opportunities virus. It doesn't prefer women to men. It infects both of us. So we try and prevent infection in both of us. And that's getting girls, boys, 90% of them vaccinated by 15. Now that we know that one dose is likely to be effective, that makes it easier. Then women who are screened. Cervical cancer is the one we screen for. And we want to make sure that all women have the ability to get screened by HPV testing. And the two tests would be enough, 35 and 45 years of age, and then treating the lesions we detect. Because remember, screening without treatment is not what you want. You want to treat as well as screen. And finally, for women who've got disease, including the precancers, but targeting very much the invasive cancers, we want them to receive the appropriate treatment. Each of these is actually much more challenging than the one before. Vaccination, we've got infrastructure for immunization. Screening is a very expensive and logistically complex intervention. So that's an exponential increase. Treatment, this is sophisticated, it needs trained medical professionals, it needs money, but we've got to do it. So those are our objectives, and that's what this campaign is about. And how does the campaign run? Well, I'll ask Anita to tell you.
Anita, you're on mute.
Myself, yeah, I was keeping quiet while Margaret was talking. So this year for International HPV Awareness Day, which is coming up faster than it always comes up faster than you imagine it will. So it seems a long time away when we start planning, but we're now coming up fast. We usually, as we have this year, really start to ramp up our campaign around World Cancer Day, because it's an excellent opportunity for us to highlight the links between HPV and cancer and the unique opportunity that we have to eliminate a whole raft of cancers caused by this virus. So this year for our campaign, and you may have already seen one of these videos pop up on your social media channels, because they've already started to prove phenomenally successful. But we're leveraging lived experience this year, and it's really so we've gone around the world, we've found strong advocates who've experienced HPV-related cancer, and we've asked them to share their story. Each of those stories is then used as an entry point to the campaign for different cancer types and for different demographics. Our goal is through the year to diversify that if we possibly can, with more voices, more locations, different age groups, etc. As always, we're maintaining, while we're talking about a cancer experience, we're maintaining our focus on HPV awareness. This isn't a cancer awareness campaign, it's an HPV awareness campaign. So each of these people have a call to, each of these videos and each of these individuals have a call to action around understanding HPV and getting vaccinated, getting screened. Next slide, please. And to help our partner, we have the IPVS for the campaign. And when I first remember sitting down and talking about how we were going to generate this campaign, we were like, well, IPVS is a fantastic organization, but they're mostly doctors and scientists. And with the best will in the world, we've got to get out there and communicate with people. And we've got to find a way to do that and to mobilize other people to do that. And so the route that we've taken is the development of strong partnerships with, and we now have significantly up on. We're over 130 partners now in global regions around the world, varying in sizes. And we also have, so we leverage that, and we also leverage a public-facing campaign, which we drive, which is what you may have already seen, where we have our social media assets and we push them out and we promote those, and we have digital advertising campaigns. We use our resources to get those ads in front of people in those demographic groups and audiences that you saw earlier. So in our public-facing toolkit, what you will see is guidelines on how to use the campaign, our One Less Worry branding, each of those testimonial videos. We have social media posts that are ready to download and go, which some of them are emotional and they draw on kind of more of the heartstrings side. Some of them are scientific. We find that different groups of people want to use different types of assets. So people who are less more in the activism side of things and less in the science side of things tend to want to use the emotional content, whereas our scientist friends and colleagues love our factual content, and we see a lot of that mostly, and that tends to also go into different social media platforms. So the emotional content works well on Instagram, Facebook, and those channels, where the scientific and the more factual goes down very well on Twitter. Sometimes a bit on Instagram, but Instagram likes faces. So that's where we go with that. We also have a lot of resources that can be used in the broader environment on the street. So we have street art stencils. We have we've seen some of our partners use those ads on bus stops and in public transportation screens and so on. We've got a community flyer, and we've got WhatsApp materials. I'll get on a little later as to where different things can be found, but that's our toolkit, has all of those things. Some of them are public, some of them are just for partners. So we've pulled together a video. We've got all of these 5 testimonial videos. I think we're going to share with you just now a highlights video, which kind of gives you a taste for what each of those videos are. This pulls together a section from each of the storytellers so that you can see how those stories have been treated. It's always a bit nerve-wracking getting the video running.
But my world stopped.
No lograba comprender.
Na wale ambao walikuwa wanapitia saratani ya mlango wa uzazi.
I was so nervous and worried.
Fiquei abalada, falei, como assim? Sempre faço meus exames, agora estou com câncer.
Soy Natalia y soy sobreviviente de cáncer de cuello uterino.
Meu nome é Márcia, tenho 61 anos, tive câncer de colo.
Jina naitwa Millicent Kagonga, ninapigana na saratani ya mlango wa uzazi.
Hi, my name is Jason Mendelson, and I'm a survivor of HPV-related tonsil cancer.
My name is Mary, and I am an anal cancer survivor.
Comenzaron todos los estudios y se dieron cuenta que era un tumor endocervical. Tuve una histerectomía total.
I had a small bump that appeared on my neck out of nowhere, and weeks later ended up having a radical tonsillectomy, neck dissection, 42 lymph nodes removed from my neck.
Em 2020 fui fazer meus exames para o Rollout e deu uma alteração. O resultado da biópsia foi câncer invasor positivo para HPV.
So I booked in to see a colorectal surgeon, and he examined me and said, "This isn't hemorrhoids, you've got anal cancer."
Y yo solo pensaba en mis hijos, en Daniel, en Stephanie, en mi mamá, en mis hermanos.
Aí fui me acalmando com o apoio da minha família, dos meus filhos, meu marido, dos profissionais de saúde.
And I decided to go public with my cancer story to save the lives of boys and girls for generations to come.
Imenipatia nguvu ya kuongea na ninafurahia uhai ambao niko nao.
And I started a charity to support and advocate for the anal cancer community in New Zealand. HPV affects us all. Let's tackle it together for one less worry.
Curar essas mulheres, fazer esses exames preventivos, que é muito importante. Através dele que me curei.
Unaweza ukapata matibabu ukapona kabisa.
HPV affects all of us. Together, we can beat it.
So that gives you a kind of summary overview of each of those stories. Each person has their own full video. That's, as I say, that's just a kind of edited together selection. And you can visit those, all of those are available on our website. But as I said, we're pushing those out on social media. I think we've had well over 100 million views on several of those videos already. The response has been incredible, and we're expecting a peak on March 4th. So these have really resonated, and we're really pleased that that's the case. And as I say, we hope that also generates and encourages our partnerships and people on the ground to share their experiences of HPV cancer as part of the conversation, and we'll be monitoring that and looking at that in the run-up to HPV Day and on HPV Day itself. But we would really encourage people in our networks to start thinking about those vocal advocates, those patients that they've seen that have got great stories to tell and who would be willing to do this. We don't underestimate how hard this is for people to do, and we are incredibly grateful to the survivors that have done this for us this year. Next slide, please, Chris. So you can see here that each of those stories we've used to turn into posters. Those posters can be downloaded from the website. Each poster has got a QR code on it, which you can see down in the corner of Marsha's story there, for example. And by scanning that QR code, you get taken to our campaign website, where you will be able to find out you'll see the whole video. You'll also find out more about the facts, the HPV facts specific to if it's cervical cancer in women, then you'll get content that from our website that has been curated onto that page. But you'll also get forward links to all the other campaign pages on the website. Next slide, please. There on the website, you'll also find a social media and poster builder. Now, this enables people. We've expanded the languages on our website this year, so you'll find that I think we have 10 global languages available. Our website is available in 10 global languages. Our campaign resources, however, don't span those 10 languages, which means we do have a bit of a gap. However, our post builders and poster builders you can either select a language you want to use or choose another. They're language neutral. You can go in here and create your own poster, upload your own photograph, type in your own message, and download your own poster or social media posts. So that gives a lot of flexibility to the campaign in places where we have, like, the translated materials aren't ready. We also, with our partners, you have the option to take design files, and I'll get to that in a minute, and produce your own versions of what we've done. And I understand some of our partners have already started to do that. We have partners in Ghana, for example, who've produced this in 5 Indigenous languages for their country. Next slide, please. Yep, you can go to the website. You'll be able to download static Facebook and Instagram posts. We've also, if you go to people who use Instagram and know this, understand that reels and video are very important, that kind of sharing your own content, and that you can apply different designs and GIFs to your content while you publish. And all of these little symbols, which you see scattered through our campaign, the Zen brain, the thumbs up, and the rain clouds and the HPV virus, those are all stickers that you can apply to your own and make bespoke social media posts on Instagram. Next slide, please. The factual posters follow the same format as the factual social media posts. Next slide. And you can see we provide a range of examples of how our branding can be used by our partners. Next slide. So we've gone through. Our website provides all of the public-facing campaign materials. That's available to anybody who wants to support the campaign. The social media post builder is there for anybody who wants to share a story. That can all be found on askaboutHPV.org. As I've said, all of the content on that website is translated into 10 languages, which includes Arabic, French, and Urdu and Hindi. So there's a broad range of languages there. You can choose to filter the content through there. So that means all of our HPV related questions and answers, all the scientific information that's targeted at the public, is available in a range of languages. That's there. For our partners, who are the trusted people that we've signed an agreement with, and we know that we can trust to develop culturally sensitive adaptations of the material that we're producing, and that reflect their local communities, we provide those with those organizations with a little more leeway, and we provide a full access to a folder with design files which allow people to develop their own versions of campaign material, co-brand with us, use our branding, include QR codes that take the local audiences to a local source of information or a local resource, or a local screening service. That is down to our partners to decide how they want to use that. All of that information is available through the IPVS HPV Hub. So you can go there and get access to that. If you're a partner, you can register. And if you've not registered already, you can register. We approve your registration, and all of that material is there. We strongly urge you to do that, because there's a lot of other resources on that website too, that's worth having a look at. That's there for people with an interest in HPV awareness and advocacy. You can also contact Chris, who is on this call, and she will also help you if you're stuck or if you don't want to register. And you're a partner. You will already have had contact with Chris. Our partners are strongly engaged with Chris. She's fantastic at getting everybody informed and engaged, and she can also provide access to those design files. Can I have the next slide? So the additional things, you get the design files, you also get additional photography that we've purchased that we hope provides enough of a diversity that people can develop high quality materials that work in their location. But you also have, as I say, you have the elements to be able to take your own photos and to develop those yourself. Next slide, please. Yeah, there are specific resources. We don't want everybody to be able to kind of go out and paint their local town and with our branding and maybe get us into trouble. So that's available for our partners. We trust you to seek out the necessary consents before you go painting underpass walls or shopping centre walls. So yeah, that's another thing that's in the pack. We've also provided a template leaflet which allows people to provide information about it's completely flexible. You can provide information about local events that are happening, local services. If you were, for example, offering free screening in your community over a period of time or promoting that, you could use these leaflets to share that information, hand them out to people in clinics or in supermarkets or wherever you feel like you might be able to access the relevant audience. Again, these have been translated. And this year, this is new for us. The campaign flyer was new, but really in recognition that our stakeholders around the world are increasingly moving to WhatsApp to communicate with each other, the importance of WhatsApp groups for sharing information and for having conversations. So we've developed a WhatsApp community, and we'll be working with our members to create more regional communities around the campaign. And we've also produced specifically formatted resources that are easily shareable on WhatsApp. So people would be able to use those formal and informal communities that they have on WhatsApp to share information about HPV. And there's a guide to how to use that on our hub. It's fine. And just really to highlight that while this year was several of our activities, and certainly with the lived experience videos, we're in the kind of the identification and early treatment territory of HPV. It's the third. All of the pillars are interdependent for the elimination of HPV-related cancer. So it doesn't make sense for us to talk just about one thing. This has been a cumulative campaign. We still have all of the resources available around vaccination, around screening. Those are still there. We would encourage our partners to use whatever makes sense to them for HPV Awareness Day, and to just have a look. If you've already translated some of our previous materials into local languages, we are absolutely fine for that to be used this year. If you want to change and align, that's fine with us as well. We just, as I say, all of those resources have been developed to be helpful in raising awareness and encouraging action. So use them in the way that makes most sense to you in your community with your priorities. And just a reminder on the hashtags. So we have the specific campaign hashtag, which is One Less Worry. A lot of people choose to use a more generic HPV Awareness Day hashtag. We monitor them both. We actually compare to see how our specific campaign performs against the general HPV awareness content. And then year round, we use our more neutral campaign. It's been there for about 5 years now, Ask About HPV. So those are the things that we look at and monitor. Using these hashtags means that your content is part of our overall conversation. It helps us to view it and to share it. Anything with a One Less Worry and HPV Awareness Day hashtag gets automatically fed through onto the homepage of our website. We have a social media screen on our website around IHAD. So it creates a wonderful picture of what's happening around the world. So it would be great to see content from MENA on there, and those are the hashtags that will help you to make that happen. And that's it from me.
You're on mute, Nori.
Okay. Yes. Just realized that. Thank you so much. Thank you so much for these wonderful talks. And especially, I would like to start with Dr. Stanley. The way you use that equal opportunities virus, I think I'm going to talk about it exactly in the same manner. I think it is an equal opportunities virus, and that is how we are able to sell it in our countries, because if it was just a woman's thing, maybe, people would not pay so much attention. But we know that head and neck and oropharyngeal and anal cancers, both men and women share the burden. So that was excellent in the way you got the 3 WHO pillars married to the campaign was beautiful. Thank you for that. And then Anita, your presentation was beautifully colored. All these colors that IPVS uses, they are just so attractive. I don't think anybody can not look at these posts. So thank you very much. There were quite a few things that I wanted to ask Chris, and I have been asking her every now and then, but you clarified it very beautifully. So thank you very much. And I think this is a very clever, 2 columns. One is the scientific one, and one is the heart column. One is the brain, and the other one is the heart column. And so I think that will improve access and approach to all groups of society. So thank you very much, both of you. It was very interesting listening to you. And I'm just going to say a few words about what is happening in Pakistan as a component of the MENA EMR, and how things move here in most of our countries. This is the recent most Globocan data which just came out a couple of days ago. And cervical cancer is included in the top 5 cancers in women, also responsible for the topmost mortality of women. And Women with cervical cancer usually are younger women compared to endometrial and other cancers, and they leave behind orphans and devastated families who are never the same after those mothers are gone. When we talk about the EMR MENA region, one woman dies of cervical cancer every hour. And in Pakistan, for whatever data we have, and I think it is just the tip of the iceberg because many women are just not able to report to a hospital, we have an average of 14 deaths, which means roughly 420 women each month. And imagine it's a Boeing 777 crashing every 3.5 weeks. And there is no headline news and there is nothing because people hardly know about it. So IPVS has been a great support because of their wonderful materials that Anita shared, that we are able to speak to people, all groups of people who really need to know about this cancer, which doesn't have to be, which is almost entirely preventable. Next slide, please, Chris. So this is really just a brief summary of the talks that we have had about cervical cancer in general and HPV included in them in different categories. I spoke in the London Global Cancer Week. Then we have our civil society organization meetings, sexual reproductive health group meeting, country engagement groups. I had a talk in Aga Khan University. I presented in the Kamkana, which is the King Edward Medical University Symposium. And then there are a few organizations where women work, like Packages and Nestle and, US group of companies, which is a big garment factory. So in all the places, talking to even educated and intelligent women, HPV is a new thing. They don't know about HPV and they want to know about it the moment you start talking about it. So the campaign material that we have is an excellent resource to take this word out. Next slide, please. And what is very important in the context of MENA and Pakistan is that we have clear messages, and this STI HPV association is something which has to be catered for very, very carefully in the context of our countries, because one wrong connotation can take the whole campaign down. So I have realized over the years that it is so much better, especially when you're talking to the government people and the policymakers, it is so much better to talk about the HPV related burden of disease rather than just tying it to STIs and HPV. And I think that's how they are more conducive to listen and do things. So I have translated the material that IPVS shared, Chris shared in Urdu as well, and we'll further work on that. But it's an excellent resource, and I would encourage all to modify them into their own personal cultural context and use an integrative approach, like Anita and Margaret both stressed, that we have to talk about all three things. Nothing works in isolation. So we have to have the vaccination, we have to have the screening tests, and we have to have the treatment facilities. So I hope we can make better use of these resources and help our women to give them the awareness that they deserve. And hopefully we should be seeing cervical cancer to be the first cancer to be eliminated. I think it is time for the question answer session, if there are any.
I think we just wanted to flag this. There'll be a high-level panel event for the campaign on March the 4th. This is our kind of more policy-oriented content. So we do our public-facing, but this is more professionals and advocacy session, and we'll be running that on March 4th at 4 p.m. to 5 p.m. CET.
I think it's also important to stress that the speakers at this high-level panel, particularly the professionals, are saying, giving messages of hope. So they're saying it is very challenging to treat in low and low middle income countries. But there are strategies, there are efforts to do so. And I think that's something we as professionals have to keep thinking about. Let's not give messages of doom. Let's give messages of hope. This is something we can do. And that's what this campaign is about.
Yeah, I think that emphasis on the one less worry, we pick our speakers to be people. We talk about opportunity, we talk about challenges, but we talk about opportunities. And we find people that can talk about what they've done in their country that has moved things that have moved forward as a result of policy and healthcare system change. And I think that those are, and we look at that in low and middle income countries where the challenges are quite significant, so that there's not a question of, well, we don't have the money to do this. We don't have the resources to deal with this. We're providing examples that what it takes is political will and a willingness to do something, and you can deliver change in any economic context if there's the will to do that.
Absolutely, yes, that is very, very correct. And it is equally important to understand that awareness raising is one of the most important things that can actually help women to come in at an early stage, because the biggest problem that we all have in the low MICs is that they come in stage 3 or 4 when there is a huge drain on their own health, their finances, and on the governments. And I think if we invest a little bit in the awareness raising and vaccination and prevention, that will go a long way.
So I think we've got to the point of asking our audience if they have any questions.
Correct.
And if they're...
I have a question, if I may ask, while we are waiting for other people. Chris, many people ask if we can have the bracelets and the pencils rather than just the soft copy of it. Is that a possibility at all?
I wish I could answer that. Of course it's possible, but that's all resource dependent. So I would say that in your request...
Chris is breaking up a little bit.
Okay, well, it's resource dependent, and send your request and we'll see what our Awareness Campaign Committee, how they can respond. But in general, we rely on our partners to produce their own materials.
Okay, thank you.
I think you need a sponsor in your own country to take on this, because it's the cost. It's like all these things, it's the cost.
Yeah.
So I think that's why it's so important to find an influencer or an organization in your own neck of the woods who will take this on and see it as a serious and important activity.
I would like, if I could, send everybody a big, beautiful T-shirt to wear on March 4th. But yeah, that stays in the aspirational mode for the time being.
Well, we've always got time to see if we can find some.
I think we've spoken before about
billionaire.
And I think we've spoken before about kind of low-cost solutions as well. You can buy printable T-shirt stickers that you can run through through a normal printer and iron onto T-shirts. I think we've had conversations about whether we could look at that, but we're always at IPVS, we're always challenged for resources too. I think we do an amazing job with a small pot of money to get the impact that we do, and we're always really proud of it, but it's always a significant challenge to work out how we're going to do this.
Yeah, but that's a challenge for all big things to be accomplished, Anita, but I think IPVS has done a brilliant job.
And I think we have to keep doing it. And if there's if there are questions, and we haven't got time to address them. We can always do it by sending messages via the chat, sending them to Chris, and we'll respond as well as we can. But I think it's perhaps worth finishing with this information. It's from WHO. It is the most recent publications. The global cancer burden is growing. It's growing for a variety of reasons, but namely because the world's population is growing and we're aging. And that is a critical aspect. And cervical cancer, in countries like the UK, we're controlling it very well, and our vaccination has been astonishingly successful. So in Scotland recently, they've published that if you've been vaccinated in our vaccination program targeting girls 12-13, then there are no cases of cervical cancer in the under 30-year-olds. And that's really critical when you look at the statistics that we had before the campaign started. It will interest people to know that the peak incidence of cervix cancer in the UK was in the 25 to 35-year-olds. And that's a testament to two things. It's our successful screening program, which is criticized again and again and again, but it actually has an impact on older women because the older women come for their screens. And that again is a real message for anyone starting a screening program, making sure you motivate the women to come in. So the vaccination works, but you've got to target the age group. And then you've got a huge rump of cases, which is why you have to have screening. And cervix cancer is actually the most common cancer in women in 25 countries. And you'll be interested to know it's the most common cancer in women under 40 globally. That's, again, the impact in high income of screening and the lack of screening in many other places. But it can be eliminated. And you've got to scale up the WHO Cancer Elimination Initiative. I'll leave you with this one sort of off the cuff. Vaccination plus screening equals goodbye cervical cancer. Thank you.
Okay, Anita, I would thank you all and request you to just say a few more words about the campaign on the 4th of March, and then we can say goodbyes. Over to you, Anita. Thank you, Margaret.
Okay, so just I hope now you've all got a really strong idea of where you can go to get the resources, and you're feeling really inspired to get out there and share these on your in your communities, and both your physical communities and your virtual ones online. Do make sure that you're following us on social media. You'll get lots of prompts there about what we're doing and links to and recurring links to our materials. Don't forget that our website has a whole raft of information. While we create all of these beautiful resources to go on social media, but really what we're doing is trying to create something really attractive that's going to direct people to a source of solid information about HPV and cancer, which is what's on our website and what's available in all of those languages, to really help to push this back. It's great having a few words on social media and a couple of sentences, and if we manage to get visibility for that, we're delighted. But the gold for us is when people come to find out more on Ask About HPV, so we would really welcome that. If you have any questions, if you're interested in formalizing a partnership with us, then I would send you to our wonderful Chris, who will be able to share more information about that and onboard you as a partner. And the email address is there, hpvday@kennis.com, for any inquiries to do with the campaign. If you have ideas If you want to share what you're doing and what you're planning, we love to hear that, and we love to see your reports on what's actually happened on the day. So please just keep in touch with us, and we look forward to seeing a raft of activity around the world.
Excellent. Thank you very much. So I think it's just about time that we wind this webinar up, and we look forward to hearing from you. And definitely, please make use of these beautiful resources that have been developed, and we in MENA look forward to adapting them for our own countries and using them for the benefit of the women and our nations. Thank you, Margaret. Thank you, Anita. And thank
you so much, Noreen, for hosting. That's been wonderful.
And thank you so much, Chris, for all the background work. Bye-bye.
My pleasure.
Bye.
Bye.
Thank you. Bye.